Today on this episode of The Brain Surgeon's Take, we will be discussing America's mental health crisis with Chair of Informatics and Health Data Science at the University of Miami, Dr. Azizi Seixas. Understand the growing psychiatric epidemic that plagues the United States, its roots in technology and social media, and plans to hopefully ameliorate our country's dilemma. Much more on this podcast episode. Welcome back, everyone. Here's my take on Dr. Azizi Seixas. He is on the forefront of America's war with mental health issues. As director of the Media and Innovation Lab, as well as chair of informatics at the University of Miami, Dr. Seixas has the experience and data to understand the psychiatric dynamics raging through the USA. Dr. Seixas was awarded one of the top 100 Black scientists in America for a reason, with his work being supported by the NIH and NSF, as well as appearing on CBS, CNN, NBC, Associated Press, and The Guardian. He is a nationally recognized expert in adolescent and adult psychiatry. So what exactly is going on in this country? We are clearly in the middle of an unprecedented crisis. It seems like every other person has a mental health issue that needs professional attention. Why? How? And what do we do about it? You will love this interview. Dr. Seixas dives deep into the culprits disturbing our mind state. More importantly, we discuss how to address these underlying factors and hopefully slow down this epidemic. Listen up as we discuss America's mental health crisis. Check it out. Hey, Azizi, how you doing?
I'm well, Rick. How are you doing?
I'm good. Listen, I'm very excited to talk to you today about such a hot topic, the mental health crisis here in America. And again, thanks for joining us.
Thanks for having me, and really appreciate the opportunity. Wish it weren't under these circumstances because there is a lot of bad news, but there's some good news, and hopefully we'll be able to discuss good news and solutions for the people who are listening to this great talk.
Well, give us a little background, Dr. Seixas. How bad is America's mental health crisis currently?
So here's how I would do it, and I don't want to be too academic, but I think it bears some form of nuance. So there are really three things that are going on right now. There is a youth mental health crisis. There is also a serious mental illness crisis, by that people with severe mood disorders and anxieties. But there's also a substance use disorder, crisis that's going on. And so where the United States ranks in terms of general overall mental health issues is that, a survey was done, and I think it was actually published in USA Today, where the US actually ranks 29th out of 30 countries when it comes to depression and mental health. And this is in comparison to, countries like Greenland and Greece and Spain and Portugal that really have the highest rates of mental illness. But it should be contextualized, Rick, because here's the deal. So while we are not the worst, but we are the largest country in the top 30, and what we have also seen is that over the last few years, due to COVID, that we've seen a 25% increase in the amount of mental health issues that we have seen. So, as I said, at the outset of our conversation, there's going to be some good news. We're not the worst, right? But there are some alarming new trends that give us some concern and pause that I'd love to chat more with you about.
So I guess that's a general overview. More specifically, what are the top three forms of mental health crises that we're experiencing here in the U.S.?
No, good question. We've seen significant increases in depression. So individuals who, experience some form of depressive episode, someone with a diagnosis of a depressive disorder. I think anxiety has ran very rampant as well. And then the third would be substance use. So we saw this in the opioid epidemic. But I think the opioid epidemic really masks, I think, a hidden crisis that people are in pain. And as a result, people choose illicit substances to heal or to take care of whatever psychological distress that they may actually be experiencing. And so there have been some studies that have shown, not just looking at disorders, because I think one of the areas that your audience may appreciate is that, yes, you want to look at the diagnoses. Diagnoses are, are instructive, but what we know is that if, for example, the US has, I think, a 5% prevalence rate of, mental illness, throughout. And some may say that's not a lot. But when you look at certain, surveys that have been done where they looked at several different countries and they asked people how distressed you are and to rank your mental health well-being, that the United States actually ranks lower than their other counterparts. And so that's the alarming thing. It's not just the diagnosis, but how many people, endorse general emotional distress, which is a combination of feeling stressed and anxious and depressive symptoms, maybe even not getting adequate sleep, and that may manifest in insomnia like symptoms. And so this is what we're seeing, that it's really hard to disentangle if someone has a mental health issue, right, versus they have something where, like, an emotional distress. And I think that's the challenge that we have today.
The big question that I think a lot of lay people have is how much of mental health is biological versus environmental, right? So we know that parents who have mental health issues have a higher risk of their kids having it because there is a genetic component. But in your experience, how much is genetic versus environmental?
Yeah, so I don't want to do a double dutch on you, right? Because I don't want to be evasive. It's hard. And I think what we've seen in several epigenetic studies, that it ranges, right, in terms of how people attribute whether or not someone's mental illness is primarily nature or nurture. And I think you articulately described what it is. It's both, right? How we look at it in a more nuanced way, if someone has the predisposition, or someone who is at risk for a mental illness, whether it runs in their family, that they may actually have a higher likelihood of developing symptoms at critical ages and periods. So whether it be depression or anxiety or some form of psychosis, schizophrenia, or a major depressive episode or bipolar, that it really depends. So there needs to be a genetic loading that puts someone at risk. So here's what I would share, though, for people to fully appreciate. Because if I were to just tell you, hey, quantify, well, it's 50% nature and 50%, environment, that wouldn't do anyone justice. Why? Because for some people, it may just take one event, one significant life trauma that could be significantly disruptive or set someone on a trajectory to develop mental illness. And so one of the things I also want to highlight as well, and I was just at a talk yesterday, and something that we discuss, but we don't discuss openly as a culture because I think it's so political. And it's the high rates of PTSD, particularly among our armed forces, whether in service or they have retired. And I know the Army provides tremendous support for these individuals, but unfortunately, they need round the clock support. And I know some people are doing some good work, but there's just not enough. There's just not enough. And this is something that I am committed to. In addition to that, I also worry about the youth mental illness and mental health issue, as I had shared at the outset. So we started a project here in Miami called STEM Cell. It stands for Science, Technology, Engineering, Math, Social, and Emotional Learning. And that was really guided by some of the data that we saw, especially at the heights of COVID. Kids weren't going to schools, and as a result, that they were not getting all the necessary resources, right, in terms of counseling and the like. In addition to that, what we saw was that this trend, the youth mental health issue, predated COVID. And what we saw and not to be political, but there has been a steady decline. And, if we want to be a little bit kind of bombastic, an evisceration of key mental health services that are not necessarily in a clinic, but these are services that were baked into schools. We have found that those services have been declining. And so what we said was we are going to create something that was destigmatizing through the use of a digital solution where we provide that support for the staff members, for the kids and students, and for their families. And we've seen significant successes already with engaging, schools as well as students, and not just schools where it's this brick and mortar school system, but we've also engaged with home schools as well as online schools as well. And I think those are the areas. Our armed forces, our veterans, and our youth, those are the individuals who I truly believe that we need to pay some attention to. And I think there's a third. And I think, the type of work that I do, Rick, I really care about individuals who find themselves on this marginalized group, right? And I think our racial ethnic minorities, right? We looked at the data here in Florida. And the data may have changed, so I don't want anyone to get upset with me. But at the time when we've created our digital mental health program, we saw that about 68% of Floridian families do not live close to a licensed mental health practitioner. And that's alarming for us, my friend. So, racial ethnic minorities, people who live in rural areas, who typically don't have access, whether be proximity, whether in terms of the wherewithal, they're the folks who are suffering. And then the last group are older adults, so our aging population. That what happens is there is this conflation with aging and decline in cognition and mental status. And I think that they are two different things. They may relate to each other, but unfortunately, when an older adult is going through a mental health or adjustment, mental well-being adjustment issues, we can't just chalk it up as just this is how it is when you grow old. No, what we see now is that older adults are living lives with vitality, with tons of friends and social connectedness. But unfortunately, there are some who don't have that. And so this is some of the things that we're working on. And I just want to spotlight those individuals because it's all about, finding those personas and those stories of the people who live on the fringes and are marginalized, who need desperately mental health care.
Now, you had mentioned key contributors towards the mental health crises. You mentioned COVID, which we all knew just threw this country for a spiral. You talked about substance abuse, which of course correlates heavily with mental health issues. I want to talk about advancing technology in this country and really throughout the world and how that has impacted mental health. In particular, we're in the information era where everyone's a slave to their emails and their texts. There's no such thing as disconnecting anymore. You and I both know that for sure.
Yes.
Uh, how much of a role does that play in burnout and in mental health nowadays?
Wow, man, you're hitting it. I love that question because I believe some of my middle-aged folks and young folks might say, "Hey, Azizi, what's we need some love too." I think that's the issue that they face. One of the many issues, right? So I was joking with my wife. So please allow me to share a little bit about my own life. So I was reading where people were saying that hey, they're gonna push retirement age to 70. And I'm like, well, I guess when you look at life expectancy, right, that, the trajectory shows that we should extend it. But one of the things my wife and I scratch our heads and say, can you imagine working like how we're working now? Always having to be on, always having to be available, always being stressed, always multitasking for another 5 years? So you literally work like this for 40 years, if not more, of your entire life. And we have to be careful about that, right? So we're not thinking about the mental health and the brain health implications of those things. I point that out because it really forecasts what we need to do today. Because if we feel like we can always be on, those can have some significant long term negative effects. So you're right that yes, people are thinking that they always have to be on. People are very hyperactive. People are always trying to do more. People are more stressed. And I think it's not just the mental health implications, but the stress that is part of the larger umbrella of mental health can actually start impacting your physical health. Such as, this is why I believe, I don't mean to be conspiratorial, but this is why we're having, an uptick in younger folks having heart disease. This is why we're having younger folks having diabetes and being more obese and having higher rates of cancer. So I think this is weird to answer your previous question as well. That stress on our daily lives and this culture of always being available and accessible and being on has caused significant negative effects in the immediate and long term.
I would say, absolutely. I feel like, just like you said, you're never off, right? Like,
Yes,
even when you're
yes,
on
yes, yes.
vacation, you can't turn that phone off because you come back to
No,
10,000 emails and 500 texts,
exactly.
and it's ludicrous that we're expected to be on this treadmill, and the treadmill's only speeding up. It's not
Exactly.
it's not slowing down. So, I don't know what the right answer is. I think the information era and the technology allows us to be more efficient, more productive. That's positive. But at the
Yes.
same point, I see the way people did things in the 80s and 90s, and they went on vacation and they totally disconnected. And I
I
think,
I love I love this, and again, I don't want your audience to say, these middle-aged young guys who are executives, these are rich people problems. It's not, because when we do our community-based work, when we go into so-called hard to reach communities, we don't call them hard to reach really anymore. They say the same thing, having to do more with less
mhm,
and less time. Even
yeah,
though the world still spins in the way that it did 20, 30, 40, 50 years, hundreds of years ago, it's
mhm,
still, we're being asked to do more. And I agree with you. Information age is one, efficiency is one, and just trying to juggle. I see this with my wife, and I'll tip my hat to her that within a day, I see her play 5 roles, right? An executive, a mom, a wife, a daughter, a friend.
yeah. That's a
And there's
lot to
more.
ask. That's a lot to ask from anyone. And another thing that goes very much with the information age that I want your input in is
Yeah.
the role of social media.
Yes.
Social media has exploded. Social media used to be something that was just for kids.
Yes.
It's now at all age levels. What do you feel like the role of social media is in America's health crisis?
Wow. This is a hot button topic because I don't want to date this interview, but just recently, that Congress had some of the social media tycoon, leaders come in and asked questions. I'm a little bit, my perspective is nuanced actually. One, because I'm a digital person, right? And I'm a technologist at heart. I do recognize that technologies are tools and they can be used for good or they can be used for bad. And I think what we definitely need rules, we definitely need policies that can protect our youth and everyone against some of the unfortunate ills that have been created and derived from the use of social media. So there are several things about social media. One is the frequency of its use, the content, right? And just the general stimulation from it. There's some other components, but let's just talk about each of those components so that I can link those with kind of general mental wellness and health being. So one is when you're talking about the frequency, a lot of us are tethered to our devices. There's this thing now called technophobia, so to speak, right? Some people are fearful of it, but some people actually just love it. Like the phone itself is like an appendage, right? Like, where is it? Like, it's like back in the day, when people are leaving their homes, you're like, where are my keys? It's like, where's my phone, right? Or where's my device? So I think the constant, tethering to your device and the alerts, and this is where the stimulation component comes in, the constant alerts, the constant need for likes and social desirability affirmations, I think really has, I think, not just gutted us, kind of morally, psychologically, as a species, but also individually as well, right? That someone makes a post and you want to see how many people liked it because it's some kind of validation. And then I think it's a content as well. What we do know, especially when there is such disinformation and distrust in our world, that social media now becomes that medium or media that pushes a lot of those distrust. And I think, not to use a philosophical term, but existentially and psychologically, that's disruptive to our psyches. That when you can't trust, or there's this general sense of cynicism and dissent. Now, it's good to be skeptical of truth, but then some people find themselves in this mental inertia. I don't know who to believe. I don't know what to believe, right? And I think that can cause cognitive load and wearing, like brain. There's this concept called weathering, that over time, when you're stressed and all your cognitive faculties, the coping strategies that you would use have depleted, it no longer protects you, right? There's this portion of your brain called the prefrontal cortex that is responsible for executive functioning. If that is overloaded, then what ends up happening is that your animal instincts, that limbic system, that's what starts to kick in. And that's what we see in social media, right? That people know are just animalistic. It's all driven by emotions because our executive faculties, that part of our brain is just saturated. And I think that's what's happening with social media. So sorry it was a long-winded. I hope your audience can appreciate the
No, for
public
sure.
health, psychological, and scientific underpinnings of that.
I saw a study showing that social media was the biggest contributor to these conspiracy theories that have just run wild
Absolutely.
nowadays with politics. And like you said, I think we live in an era of distrust. I think the media in general um, has their own agenda, obviously,
Yes.
and the agenda is not to give you information; it's to make money.
Yes.
And so I think the media is unreliable. Social media has become a platform for everyone to voice their displeasure, and then that's where these conspiracy theories start to spiral out of control. And I want to ask you a very similar question. It's a little spin-off, but talking about social media and technology and burnout and overwhelming individuals, what are your thoughts on kids having cell phones at such an early age and potentially halting their interpersonal skills? Meaning, like you and I growing up, we were playing sports, we
Yeah.
were hanging out with our friends, going to movies, whatever, going to dinner. Now kids are on their phone 24 hours a day, 7 days a week. They don't even know how to hold a conversation.
I agree with you, my friend. I don't want to sound like an old fogey because I still think I'm young.
Yeah, me
Uh,
too. Me too.
yeah, well, you are young, my friend. Um, so I'll give you my scientific clinical answer, and I'll give you my personal answer. How does that sound? Is that fair?
Sure. Let's do it.
So scientifically, I will never judge a parent or a family for providing their kids with these devices, right? Because it's a so if you become this kind of austere parent, the kids will see that their friends and their classmates have it, and then that's another psychological issue, right? Because like, why do I not have it? Like I'm the one who does not fit in, right? And I think that's a huge thing that as a parent, you're always trying to juggle. Parenting is tough. So this
Hmm.
is a judgment-free zone here. There's sometimes parents lead very busy lives and they need to always be connected to their children if their children need them. And for those reasons, practical reasons, absolutely, it's important. In addition to that, that they believe if it's provided, meaning enough guardrails, that these devices and tools can be used as educational material. It can be their portal to access folks that would not necessarily be accessible in their lived daily lives, right? In their lived experience. So I just highlighted some of the benefits, and I'm sure there are so many more benefits for kids having that. However, every tool can be used as a good or for bad. And it's really how it is utilized, right? And I think this is where my personal answer comes in. So our kids do not have cell phones, they have a tablet, and we provide strict guardrails and rules and policies around. I know that sounds very strict, but you kind of have to. Why? Because we try and minimize the amount of time. Several reasons. There have been some studies that have shown that the excessive use of devices for kids can actually impact cognitive development, right? And I think those are something. Now, some people might say, well, this other study said no, and in general, some of these studies point to a there. There's a there, okay? And so I don't want to get into a debate around that, but there's a there. I can tell you personally, as I said, our kids don't have cell phones. They use a tablet, and it's used for educational purposes and for entertainment purposes, right? But we make sure that we know exactly the types of stuff that they have on. We have all the parental controls on. And we actually speak with our kids and tell them why we don't want them to be venturing off into this vast infosphere that they're not ready for certain things yet, right? In our humble opinion, that's how my wife and I, how we've raised our children. And I think that's kind of my answer to that, to be quite honest, pointing out some of the goods and not judging any parent or family who provides that to their kids, but also share with you personally how we have married the best of science in terms of my knowledge, the work that we have done, and how we've implemented it in our own household.
Now, we've talked enough about how awful America's mental health crisis is, all the key contributors, and kind of doom and gloom. Let's talk about solutions a little bit for our listeners. How important is a healthy lifestyle to avoiding these mental health problems? Diet, exercise, sleep. I know that I'm a huge proponent of that. I feel
Yeah.
like when you deal with stress at any level, it doesn't mean you have to be a doctor, but we all experience stress. Life is
Yes.
stressful in general. How important is a healthy lifestyle to avoiding these mental health issues?
Very important. I know I've been very long winded with my answers, and I'll try and be brief on this one. It's very important, and there have been several studies that have demonstrated and shown that even in some of our work, we have shown this relationship between emotional distress and healthy sleep. We've also shown that between the combination of emotional distress and the prevention of stress and having good physical exercise activity, and how that significantly lowers your risk for all sorts of chronic health conditions like heart disease, strokes, and the like. The data are the literature is filled with tons of data to show that it's important. Why is it important? One, because they can serve as preventions, but they can serve as release as well and management of these things. And it's been shown over and over that people with mental health issues, people with a mental disorder or mental illness, that if they engage in diet, healthy diet, getting good regular quality sleep, getting some good exercise, and reducing their stress, that they're more likely to better manage their condition. And it's been proven as well. So I'm not saying that it will prevent a mental illness. I don't want anyone to misquote me on that. But literature has borne that out, that it certainly helps to have a healthy lifestyle.
Yeah, I always emphasize with our residents and our fellows and friends and colleagues, I mean, you got to take care of yourself, right? We all live in this world where you're under the spotlight every day, you're under a time crunch to get stuff done. You got to fit in the exercise, you got to make time for good sleep, and you got to diet right. You can't
Good
be
for
eating
you, man.
McDonald's, sleeping 2 hours a night, and not exercising. You can't do that. So I'm glad to hear you say that.
Yeah, and it's a combination too, Rick, because what we see, and we've done this, and others have shown this, because some people will say, you know what, I'm just gonna eat well, and I'm not gonna sleep. And what studies have shown is those individuals don't confer the best health benefits,
Mm-hmm.
right, from the actual good health behavior that they're engaging in. So it really works in this yin and yang way. Don't cheat on one. That you need a good balance across all of, and we call them the four pillars: sleep, physical activity, diet, and stress management.
Mm-hmm. So what can we do as a country, right? You talked about how we're not last, but we're pretty close amongst other industrialized countries with our mental health crisis. What do we do moving forward? What can we do to address this mental health
Yeah,
crisis?
good question. I'll just I'll try and be succinct. I think there needs to be a political and policy solution. There needs to be a kind of a clinical solution by providing more care and access to treatment. And there needs to be a cultural solution as well, destigmatizing mental health and wellness. And then also some of the things that you're mentioning about our obsession with being productive and efficient and always doing more. And I think that's kind of what we can certainly do. So other countries have done a great job at making mental health less an individualistic type of framework and making it more community based, right? So that you can get more support from your community to support that. And I think those are some great lessons that we can learn and incorporate. I think from a political sense, as I said, funding, providing more access. I think we need more solutions that focus more on early screening and identification and on-demand access to mental health care. I think those are some of the areas that I think we would need. I mean, obviously, this is like another conversation.
Of course.
But in terms of solutions, there are so many solutions. And by the way, we're doing some good work already, by the way. I think we're finally understanding that mental illness is a brain disease, a disorder. It is something physiological. That doesn't mean that, that the only treatments are pharmacological in nature. I think there are some new exciting solutions that I don't know I know some about, but I'm not an expert, so I don't want to say. But I think, some folks with, there's a lot of buzz, in the use of psychedelics to treat PTSD and trauma, particularly complex PTSD, recalcitrant PTSD patients. I think those are some exciting new therapeutics that are coming out there, and then digital therapeutics as well, which primarily it's not just your garden variety mobile health solution, but it really is, very well demonstrated, very well studied behavioral cognitive therapies that have worked for people with depression or with anxiety or some other form of mental illness. And that would increase access. So I think that's kind of if I had a magic wand, Rick, that's what I would do.
Yeah. I mean, one last question. This could be your magic wand as well. What can our listeners do individually to prevent their own mental health crisis? This episode of the Brain Surgeon's Take is brought to you by Vitamin Water. Vitamin water is the ideal way to hydrate, replete your electrolytes, and maintain wellness. I drink vitamin water routinely during the day in order to keep up my energy and focus. Check out vitaminwater.com for more information and use the promo code BrainSurgeonsTake for 20% off your first order.
I think so. I think that's a great question. It's a great question. I really, it caught me a little off guard because, my initial reaction was be a clinician. And I think sometimes in life, some people just want to hear a trusted messenger. I think you gotta find ways in which you can incorporate your family and your community, whoever you call family and community, and get this wraparound support for you so that you can have the courage to go and seek the necessary mental health. And I'm not saying people who don't want to go and seek mental health care that they're not courageous. I'm not saying that, but I know it's tough. That just coming to the grim reality that I may have an issue, that it is really tough for people. So I want to encourage you, do not be afraid that there's so many folks who you trust who can walk you along this journey, and you should do so to get the necessary care and support. But that's for people who believe they may have a mental illness or a mental disorder, mental health issue or disorder. But if you're just having struggles in life in general, I still think you can still take that approach. Take care of yourselves, be kind to yourselves. Um, I was talking about social media. I saw somebody on social media was saying, hey, be kind to yourself. You're doing well. It's okay. You can't do everything. So that's what I would share with your folks. Be kind to yourselves, that you all are created beautifully and uniquely. There is no other person like you. And so that would be my suggestion, to embrace that and to lead a healthy lifestyle and having this really good, sober, positive outlook on life because you are loved. You are loved and you're made unique.
Wow, what a wonderful message. What a way to end the interview. I could say, Dr. Seixas, that I was looking forward to this interview for a while because you just see so many mental health issues that are just spiraling out of
Yes.
control. And, when you think about the causes, right, primarily our lives that we lead, the information technology era, social media, cell phones, like you were saying. I mean, these are not going anywhere. In fact, they're only going to become more and more predominant in your life. So, hearing your views on that and ways that we can address the typical stresses of life, right? Life is hard for everyone. It's not easy for anyone. And so we all go through this pressure and this stress, and dealing with it emotionally and mentally can be hard for anyone. So I loved hearing your perspectives.
Thank you, my friend.
Um, Thank you for sharing your time.
Thanks
Any
for
one of our
having me.
listeners should definitely realize that, like you said, you're not alone, right? People can be under stress and be like, wow, maybe it's just me. And they have to realize that the struggles of life are universal and
Yes,
everyone goes through it. And if you need help, there's no shame in that game at all.
absolutely. Well said, my friend. Thank you so much for having me. This was amazing. Amazing.
Absolutely. And we'll talk
Keep up
soon. A
your great.
fellow Kane. Got a fellow Kane right there.
All
So,
right, let's go, you.
all right, buddy. Have a great weekend.
You too, know, my friend. Bye now.